ministry in all of Jamaica. It's an absolute blessing. We're really excited to share this.
Tune in to CVM, see it happen.
Jamaica, make we do the right thing. Make we live good today for a better tomorrow. Talk it out. Don't fight it out. The time by the Ministry of National Security is
6:30.
The word from the World Health Organization, WHO, is do not panic, but still, they have declared a global public health emergency around Mpox, or monkeypox, if you may. Why have they done so? Because of a rising number of infections and deaths on the continent of Africa, specifically in the Democratic Republic of Congo, and the fact that there have been cases reported in Asia and in Europe, specifically in Sweden. We want to know today, what are the authorities here in Jamaica doing to screen for the disease at the borders? And even more important than that, if it comes to Jamaica, what are the measures that are in place to help to protect the population and to hold it down, hold it together so that we don't have an outbreak on our hands? We'll deal with that issue of monkeypox, Mpox, today on Lead Story. Welcome to Lead Story here on CVM TV on this Thursday. The Health Minister, Dr. Christopher Tufton, hosted a press conference earlier on this Thursday where he spoke to members of the media about the surveillance measures, the screening measures that are in place to deal with Mpox, given the declaration of a global public health emergency around the disease coming from the World Health Organization, the WHO. And at the top of the show this evening, it's relevant to play for you a bit of what the Health Minister had to say.
Surveillance is critical, therefore, at this time to rapidly identify cases and, by extension, with each case, the clusters, in order to provide optimal clinical care, isolate cases to prevent further transmission, identify, manage, and follow up contacts to recognize early signs of infection, to protect frontline health workers and identify risk groups, and tailor effective control and prevention measures. Our key actions at this time will focus on the following: heightened surveillance at our ports of entry. This means that we will increase messaging at our ports, and we will interview travelers who have visited countries of interest in the last 6 months. Anyone with symptoms will be treated according to our protocols. Persons without symptoms will be issued health alert cards and told to contact the health department if they develop symptoms. In other words, we are monitoring the countries where Mpox is present, and persons coming into Jamaica from those countries of concern may be subjected to a higher level of surveillance questioning by the health team.
That's the Minister of Health and Wellness, Dr. Christopher Tufton, trying to get ahead of the issue and convening this press conference to tell the media basically what the ministry's playbook will be from this point onwards. Now, as I told you, the WHO has seen it fit to declare a global public health emergency around Mpox, even as it is saying that, don't panic. It is not the new COVID. It is not that bad, but it is that we are making this declaration so that individual countries can begin to get their houses in order to deal with the issue, especially from the perspective of the borders of entry, the ports of entry, and how it is that screening should take place. Now, the global Mpox situation, the WHO, the region of the Americas, in the Americas, 62,904 cases have been detected. Deaths, 141 in the Americas alone. I say the Americas because that's where we are in the Americas. Since May, 215 new cases in the Americas. In June, 175, and the monthly change, 19% down if you compare the May numbers to the June numbers. And you can see that the total number of confirmed cases. The figure at the bottom of the graphic on the second column from the left, 99,176, the total number of confirmed cases. Total deaths, 208 worldwide. New cases in May, 934, which is 3% down from the 963. Well, new cases in June, 934, which is 3% down from the 963 reported in May. So just under 100,000 of confirmed cases of Mpox globally and just over 208 deaths. After the break, we'll hear from our medical epidemiologist at the National Surveillance Unit, Dr. Ardeen Harris, about some details where this disease is concerned.
School season. Shop, save and win uniforms and school supplies with Maxi Kingston. 3 lucky shoppers will win a back-to-school bundle when they shop this summer. Visit us at our Springs Plaza or Red Hills Road locations from July 22nd to August 27th and save up to 25% off school essentials. Visit MaxiKingston.com for terms and conditions. Authorized under Section 58 of the Betting, Gaming and Lotteries Act. Can't wait to see you.
The internationally acclaimed On Stage with Winfred Williams.
At a new time, Saturdays at 8 p.m. on CVM TV.
So much more than entertainment.
John Mark!
Celine, where you going? You can't say we're a friend now. Celine. We have to take on the road.
Yeah, man, we have to take out the same way. All right, Lord, thank you so much for this day.
Me, I do the work. Yeah. And the people, them accept it. Clarendon, Mandeville. But now we get to go into the inner city of Kingston.
I can't wait to learn more as we go across Jamaica into different churches to understand what they do.
The World Health Organization has declared that a fast-spreading new variant of the highly infectious disease Mpox is a global health emergency. It's the second time in 2 years it's been declared as such. The continent's leading health body, the Africa Centres for Disease Control, had already warned it could spiral out of control unless measures are put in place to limit its spread. Here's the Director General of the WHO making the announcement.
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice.
Our health correspondent Dominic Hughes told us what the announcement from the World Health Organization means.
This is the highest level of alert, really, that the World Health Organization can declare. It's on a par with what they did during the COVID pandemic, for example. Viewers might think back to those rather troubling days. This follows hard on the heels of a similar declaration by Africa's Centre for Disease Control yesterday, which declared this a public health emergency that was continent-wide. Now, the World Health Organization's panel of experts has advised the Director General, as you were saying, that actually this is something that the international community really needs to be aware of. And what it is it's a call to arms, really, to try and mobilise not just medical resources, but political resources as well. So the WHO have said they're already on the ground, they are training staff, they are working on vaccines and treatments, they are in position on the ground, but really it's trying to mobilise resources, both financial, political, medical, to try and stop the spread of this virus. It's already, as you were saying in your introduction, it's endemic in the Democratic Republic of Congo, and the vast majority of cases so far this year have been in the DRC, but it's also spread to 15 other countries in Africa, and the concern is that it could spread beyond there too.
Wow. The BBC report there, thank you for that. Now, Dr. Ardeen Harris, medical epidemiologist at the National Surveillance Unit, is joining me. Good evening, Dr. Harris.
Good evening, George.
I know the WHO says don't panic, but hearing that BBC report and reading the literature across Asia where they've heightened surveillance at several ports of entry in the leading countries, and hearing what happened out of a meeting recently of the European Centers for Disease Control and Prevention, even though they say block-wide border surveillance measures won't be put in, and then seeing that image of those patients, it's hard for Jamaicans to not feel a heightened sense of concern, I would suggest to you, Dr. Harris.
Okay, I can understand that kind of sentiment, but what we have to be reminded is that Mpox is not new to Jamaica. Remember, we had an outbreak, and that was a global public health emergency of international concern in 2022 as well. So we have seen Mpox cases before. So it's not new to Jamaica. And we know that when we see cases in other countries, because of the travel ties to other countries, we may see cases here. So it is a similar situation where WHO is basically saying because this outbreak that they're seeing is the largest that they have seen in the Democratic Republic of Congo. They are seeing where other countries are having cases and imported cases in Europe, in Asia, no. And they are seeing that a new clade or subtype of the virus has emerged. Then that is why they are putting us on heightened alert. But Mpox is not new. And in the same way how we managed Mpox before, we just have to be alert so we can appropriately manage it again this time.
All right, good. We're going to get to the management measures in short order, but I just want you to walk slowly. For those who haven't been paying attention, Dr. Harris, who've been fidgeting at the back of the class and have been distracted on their iPhones, Mpox, how does it behave? How is it transmitted?
Okay. So it is a virus, and initially what we were seeing is that it was transmitted mainly from animals to humans. So that is still the case where it can be transmitted from animals to humans. But what we're concerned about and what we're seeing more and more these days is that we're having human to human transmission. And the main mode of transmission is via contact, mostly sexual contact with persons who are infected with Mpox. Also, what they're seeing as well is that you may get it from close contact with persons with Mpox skin rash. You may also get Mpox from contact with bed linen or clothes of a person who have had the Mpox lesions. You may have it from mother to child, and you may also have it from coughing, from exposure to respiratory droplets from persons who cough or sneeze, that is infected persons. So it's a wide variety of ways in which it can be spread.
All right, we'll pick up the conversation after the break. Dr. Harris speaking with medical epidemiologist at the National Surveillance Unit, Dr. Ardeen Harris. The government has been communicating about Mpox and the measures it is putting in place to protect the country's borders first and foremost, and then if it gets in to contain the issue. Dr. Harris says, well, they've dealt with it already and they have a playbook working with. We'll go into that playbook after this. This is Lead Story.
No more fear of missing out. CVM TV News is on YouTube. Get up-to-date news, sports, and business content at CVM TV News anytime, anywhere. Subscribe now to CVM TV News to see it happen.
Bollywood has never been this good. Catch Made for Each Other weekdays at 12:30 p.m. on your drama station. Brought to you by
Look who we have in the cut. No, today episode I got nice. legends, Senator, my longtime brethren, the great all-star, the king, and the man himself. Salute! You know, as man, we're not to go as specialists, and that's the pinnacle of the problem. We want some new era. Do what you love and you never work a day in your life. Lie! You work till you weak. It was pandemonium. Country people can relate to what I talk about.
What you think about me no matter, you know. What matter to me is what I think about myself.
Man United, you know. I don't care what a man wants to say.
You know, man.
Yeah, man.
You know, man. You finished?
Yes, we finished.
The Cut is brought to you by Flo and Guinness.
The time by Grace. Taste that moves you is
6:45.
Welcome back. We're talking about Mpox with Dr. Ardeen Harris, medical epidemiologist at the National Surveillance Unit. So, Dr. Harris, you've spoken about the various modes of transmission. When that first, I'll call it a bump, I'm sure you'll call it something else. When that first bump appears on a person, and then that bump, the bumps multiply, what are the symptoms thereafter? That's the obvious one that anybody can see that something is wrong. But what follows after the appearance of these skin lesions, and if you may?
Okay, well, let's start with the bump, as you call it, because you can have a wide range of appearance of that skin rash. So you may have a bump without anything in it. You may have it filled with liquid or filled with pus. You may have scabs. These may burst, so it can go to sores as well. In addition to that, persons can have fever, backache, muscle aches. They may have intense headaches, and also swollen lymph nodes. So those are lumps that may appear under the arms, in the groins, in the neck. And you may have intense lethargy. That's one of the features of Mpox as well.
All right. So in terms of the treatment, well, not even the treatment, because I heard you say something. You said sexually transmitted. So is it that they've found that the rate of transmission is accelerated during by virtue of sexual contact relative to the other modes of transmission?
It is that they're saying that most persons who have the Mpox have contracted it via sexual contact, but there are other ways, which is what they're seeing with this new subtype or clade of the virus, where they're seeing that it's not just sexual contact anymore, it's close contact with persons and via droplet.
And this new strain or clade, as you say, is it deadlier than the previous strains of Mpox?
Well, I don't want to use that inflammatory term as deadlier, but it's close, because what we saw was there are two clades. So you have clade 1, which is the Congo Basin clade, and that one has a higher case fatality ratio. So out of every 100 persons who are infected, they may see up to 10 persons dying, as opposed to the clade 2, which is a West African clade. That is the one we saw in 2022, 2023. And what they have found is out of every 100 persons who may be infected, only 1 person would die. And what they're seeing currently in the current outbreak is not as severe as 10% of the persons, but out of every 100 persons, 3 to 4 persons may die. So yes, it is a more severe strain that they are seeing, and it's more transmissible, as in can be transmitted more readily from one person to the other, which makes us, emphasize prevention.
Yeah, and I did a quick calculation about the DRC, which is my phraseology again. You'd say different. The hotbed for the Mpox. Even there, the fatality rate, the mortality rate is about 3.4%, so not very high and not the levels that would trigger an alarm. So here's the thing now, Dr. Harris, in terms of, this is a question that most people ask. When you say contact with surfaces, that it can be spread that way, I'm giving an example. Suppose it is that in traveling, a baggage handler then has Mpox, touches your luggage, the luggage moves around, you bring the luggage from wherever to here in Jamaica. Can the virus live on surfaces for how many days? And is it likely that the infection could spread that way?
Okay, so it is, there are always, possibilities. So yes, it's possible, but unlikely in that the main mode is by close contact. So that would not constitute close contact. So close contact, whether it's sexual contact or contact with contaminated bed linen, for example, a person changing bed linen for an infected individual or a healthcare worker who may come in contact with the bed linen or the clothes of persons. It's not just a casual contact with surfaces that an infected person would have touched. But it also emphasizes prevention as it relates to hand washing, after going out, touching hands, avoiding contact with the mucous membrane, such as the eyes, the nose, the mouth, making sure that you do hand sanitization. It's encouraged to wear a mask as well because you can contract it via droplets.
Yeah.
From sneeze or cough.
The health ministry has some very, very stern nurses working for it at the airport. I've encountered them more than a few times. Those ladies, they take no talk. You have to comply with what they say when they're instructing you to go wherever to get whatever done. So in terms of surveillance at the airports coming in, is it that the ministry is ramping up or simply asking these agents that you have there to pay specific attention to certain things? And are they going to be temperature screening? Can it be picked up by temperature screening as COVID was?
Okay, so the main thing is the rash. You may have fever, but it may not be detected that way. So this screening at airports is nothing new. We would usually screen for persons who visited countries that have yellow fever, malaria, and so on. So it is to screen now for persons who have visited places with outbreaks of Mpox. So those persons would be subject to an interview where you get more details from them. And then if they're not having symptoms, then they will get the health alert card, which is to give information as to what symptoms to look out for and who to contact in the event that you develop the symptoms within 3 weeks or so.
Yeah.
So yes, there will be time screening.
Yeah, and my viewers should know that for instance, South Africa has this problem where they've set up a dedicated center at, for instance, Cape Town International, because South Africa is a hub to so many places around the world. So a lot of Africans fly there to go elsewhere. And because there are parts of Africa that have Mpox in significant numbers cases, they have heightened surveillance there. But you're saying that we don't necessarily need that just yet. It's the usual surveillance protocols that we are implementing, especially for travelers who are coming from certain parts of the world. Am I correct?
That is correct. And you can understand why South Africa would do that, because they may have direct flights to these countries with outbreaks. We do not have direct flights with countries who are currently having outbreaks in Africa.
Right. So, Dr. Harris, the sum total of what you're saying is that be vigilant, but don't panic. And persons are thinking that this is COVID 2.0, this is COVID 20 or COVID 21. You're saying that not so.
No, we're saying not so. We're saying that we have managed it before and we expect to manage it in the event that it comes here. Initially, we want to screen, we want to make sure that it doesn't come here. We want to look at persons at the airport, but in the event that it does come here, persons who have traveled, who develop any symptoms that I mentioned, have to seek the attention of a healthcare provider, or if you have these symptoms and you've been in contact with a person who has traveled within the last 3 weeks to any of these countries, definitely go to a healthcare provider. We are asking the healthcare providers also to be more vigilant and have a heightened sense of awareness of Mpox, to look out for it, to screen for it, to ask the travel history, and also to report any suspected cases so that they can be tested and we can do the contact tracing and to reduce any transmission were it to come here.
The rashes on the skin, Dr. Harris, finally, for a person who gets full-blown Mpox, all of their body covered in these lesions, these bumps, and they burst, does the skin regenerate or are there scars left over?
Okay, so it depends on people's skin type. Well, we expect that it will regenerate, so it will progress, it may burst, and then you have a scab forming which will fall and you have new skin. And that is, by the way, when a person is not infectious anymore, and that's within 2 to 4 weeks. So they are infectious until the rash heals completely.
So it behaves like chickenpox?
It does. It does. And the rash actually resembles chickenpox. It resembles herpes. So the diagnosis is especially difficult because it resembles so many other conditions that we have seen.
All right. Hear you on that. Dr. Harris, thank you for your time this evening. All the best to you.
All right. Thank you. Good evening.
Dr. Ardeen Harris, medical epidemiologist at the National Surveillance Unit. So there you have it. The word is, do not panic. The health ministry says it has a handle on the issue. They've dealt with it already. And yes, the strains that have been seen globally now, one of the strains is a little more dangerous than the previous strain and has been known to cause more fatalities than the previous strain, but not to the extent that it should cause panic to set in. Globally, though, there is monitoring. The Europeans have said there's no need to heighten surveillance at their borders, but the Asians believe so. And so throughout Europe, there's no Mpox-specific booth at the borders or any specific focus on Mpox at any of the borders in Europe. But in China, in South Korea, in India, where there have been Mpox cases as recently as March this year, they have implemented heightened surveillance measures to ensure that they keep the disease out, that they hold what they have, and that they don't have a full-blown outbreak nationally to deal with. The health ministry here has moved quickly, and it is asking for your understanding, especially if you're coming from countries where there have been Mpox outbreaks, to cooperate with the screeners who you will encounter at both major, well, we have three international airports now. When you come, you cooperate with those who are asking you questions and wanting to subject you to surveillance measures, all right? So Mpox is here, but the word is no panic necessary. That's the program this evening.